So shall I start, right? Good morning. So my name is Maya Tsereteli. I'm from Tbilisi, Georgia, and I'm representing the National Center for Disease Control and Public Health. First of all, I would like just to thank conference organizers for inviting me to visit this wonderful country. I love Tashkent, and so I have here several times. And for the opportunity to talk about the Georgia hepatitis C elimination program in Georgia and to share with you our best practices and lessons learned and future plans. So we started the hepatitis C elimination in Georgia in 2015. So before 2015, we didn't have precise information about the burden of this disease in the country. And in close collaboration with CDC and WHO, in 2015, we conducted the nationwide sero survey to get precise information about the prevalence of hepatitis C in the country and risk factors for transmission. So and based on the survey results. So according to the survey results, we see that the prevalence, HCV-RNA prevalence was 5.4. And so according to this, the Georgia was among the countries with the highest HCV prevalence. Then we started the hepatitis C elimination. So our government initiated to start the hepatitis C elimination program. And so I will tell you briefly about this program later. And so in 6 years later, in 2021, we again conducted the sero survey. And so we received amazing results. So during this period, the prevalence was decreased by 67%. On this slide, I would like just to see you main activities were conducted in Georgia in the frame of this hepatitis C elimination program. So as I mentioned, so we started this in 2015, and first, based on results, we developed the strategy of hepatitis C elimination, country strategy, and we launched the hepatitis C elimination program, of course, with support from pharmaceutical company Gilead. So that we developed a strategy for 2015-22, and so the first step after the launching the program was for massive screening program for hepatitis C. So in 2017, we started the program, what was decentralization of HCV diagnostics, care, and treatment services. So when we started in 2015, we had only 4 treatment provider centers in Tbilisi, in the capital city, and just a couple of sites for diagnostic, for the screening. But now we have more than 800 centers for screening, and so about 40 centers for the treatment of Hep C. In 2018, we started a very innovative project that was the integration of HCV, TB, and HIV detection and the primary health center care level. And that was a very good opportunity not only to find the cases of hepatitis C, but to detect also TB and HIV cases. In 2019, so all diagnostic and treatment services were free of charge in Georgia. In 2020, we started the Linkage to Care program. So we initiated this program in order to increase enrollment of patients in the treatment of HCV. Due to the successful implementation of HCV program. So based on recommendations from CDC and WHO, we started to work on elimination of hepatitis B as well. And in 2024, the government approved HBV management program. Excuse me. In this slide, I would like just to show you some key achievements. So as I mentioned already, we conducted 2 surveys. We developed the strategic plans as well as different clinical guidelines and laboratories document to support viral hepatitis elimination. I would like just to talk about the technical advisory group members, so which was a very important activity. So under this program. So this technical advisory group, so what we call TAG, comprised by 12 international experts that was established in 2016. And so every year, so we have annual technical advisory group meetings where Georgian experts present their progress of this elimination program. And so we get recommendations from our technical advisory group members about our future plan, how to achieve elimination. So very important was from the beginning, we started very big, massive awareness campaigns. So I've talked about I already told you about the decentralization and testing treatment. That was very important tool. So of course, I should mention about the universal blood screening that was implemented for HCV, HBV using NAT testing. Also, we introduced the external quality assessment system for the laboratory diagnostic from the beginning. So in 2017, 16-17, we established 2 very important committees. That was clinical committee, who was responsible for all treatment issues of hepatitis C and B in Georgia, and scientific committee for the transparency and coordination of all research activities. On this slide, I would like, so always, so people ask us about the success factors of the Georgian Hep C elimination program. And I should mention that, so first of all, this was a political commitment. That's government, so as I mentioned, so government initiated this program in 2015, and so we still have a great support from the government to conduct all activities. Second very important tool was the factor was international partnership, because we have very broad international partnership with different organizations. Even I mentioned initially, so we started this with CDC, Atlanta, with WHO, and with Gilead, with Abbott, and different international organizations. And we hope that we continue to work with them closely to achieve our goal and eliminate hepatitis C. So decentralization and simplification was also very important factor for success of this project. And so I would like just to mention about the very strong tool, what was the electronic registry. We have unified electronic registry in the country, and that's for both for screening database and for treatment database. And so we can monitor all the data, we can conduct the real-time monitoring of this data. And so also it needs to be mentioned that the importance of mass media campaign to increase the public awareness, of course. Due to the successful implementation of this program, we have received international recognition from different organizations, like in 2017, Georgia was awarded the title of No-Hep Visionary for the European region at the World Hepatitis Summit. In April 2019, EASL meeting in Vienna was dedicated to Georgia, and country was awarded with the status of Center of Excellence. And program also received recognition by CDC Director Honor Award for Excellence in Partnership. And finally, in 2002, WHO, NCDC, and National Center for Disease Control and Public Health was designated as a WHO collaborating center for the elimination of viral hepatitis. So the main goal of this collaboration center is to assist our neighboring countries in strategic development and help them to strengthen diagnostic laboratory capacity. Since 2002, we were in Georgia, so we received different delegations from different countries like Uzbekistan, Tajikistan, Azerbaijan, Armenia, and Turkmenistan. We also provide technical support to different countries. And so I should mention in more details about the collaboration with Uzbekistan. For several years, we have established very, very good collaboration, close collaboration with our colleagues from Uzbekistan under the leadership of Dr. Musabayev, and thank you very much, Dr. Musabayev. And so we visited this country several times. We privileged to get Uzbekistan colleagues in Georgia to show them our sites and to share with them with the Georgian experience. In 2024, last year, so the Georgian delegation visited Tashkent, and so we conducted trainings on simplified clinical management of hepatitis C for primary healthcare doctors in two regions of Uzbekistan, in Namangan and Atinjan. And we hope that we'll continue collaboration to achieve elimination together, right, Dr. Musabayev? So in this slide, I would like just to show that the cascade of treatment and care cascade since 2015. So since then, we conducted more than 6 million tests on HCV. So it means that 3 million unique tests, 3 million persons tested. So about 172,000 anti-HCV positive cases identified. And over 90,000 patients are enrolled in the treatment process with a cure rate of 99%. But in right color, you can see two figures. That's 8,000. So that is the biggest challenge for our program. We have more than 80,000 patients who are HCV positive, and they did not get confirmatory tests. And we have about 14,000 patients who are confirmed positive, and so they did not enroll in the treatment process. So about the next step, so that is a main challenge, and we are trying to strengthen linkage to care. And so we started implement different interventions, different activities to increase and to get all these patients enrolled in the treatment process. The second challenge still is to strengthen infection transmission prevention, so both in general population and in key population. So again, we should continue, and so the raising awareness campaigns and increase hepatitis B vaccination. And so I would also like to share with you that we're currently working to apply for the validation of PET2 hepatitis C elimination and submit to WHO. Just a few words about the hepatitis B. As I mentioned, we started to already hepatitis B program, and so based on the results, you see that it's not a big prevalence of results of this survey. You can see that there's a not very high prevalence, and so based on the results, so we have very, very low cases of hepatitis in children. That shows us very, very effective implementation of immunization program. So last year we started this program, and it's free, it's a government funded, and it's free for all Georgian citizens. So in conclusion, I would like just to say that HCV program has been a really big driver for health system strengthening and advancing in general public health agenda in Georgia. And so we are very proud of this program. We are very proud of this collaboration with international partners. And so we hope that lessons learned from the Georgia elimination program can inform programs in other countries striving to eliminate HCV as a public health problem. And I would like just to thank you all for inviting me. And so we hope, as I mentioned this morning, so together with Dr. Musabayev, we will achieve our goal. Thank you.